Everyone. It's my pleasure today to have a team of ladies from the Hopkinton Youth and Family Services. Originally, it was going to be Dawn Alcott-Miller. She's been in social work for 32 years. She recently came to Hopkinton in 2019 in the spring, and she loves all aspects of social work. We're very pleased to have her. She works with a wonderful team that she brought along with her, and they do clinical and prevention staff here in our community. And we're going to learn about what they do. And I'm very, very pleased to introduce them. So first we're going to hear from Dawn, and thank you so much for being here.
Thank you so much for having us and having me and for the invitation. I want to start first by thanking all of you. I know that the Women's Club has been so instrumental in helping people furthest from opportunity in the community through our department. I see friendly faces. I see Phyllis and Nancy and the people that we've connected with through your organization. I know some of you do it very quietly, the help, and yet you're meeting on these things and having to take votes about where your resources go. And the fact that you would trust us to be good stewards of those funds means so very much to us. And so I thought I would bring my team today because you don't need one talking head, but together, we as women can be so powerful in the world. And we have to remember that as a team, we can back each other up and we can transform lives as you have through your support of our department. And you'll hear more about that later. So in 2020, I got here spring, as was said, in spring of 2019. I wasn't here very long before a major pandemic hit. And while we continued to work through that pandemic and met with people in their backyards, whether we were in, our coats bundled up, talking with folks and trying to figure all that out as everybody was, we also did a strategic plan because the department hadn't had that yet, didn't have a mission or a vision. It was a department that was still growing when I came on board. I had spent 19 and a half years in another community where we grew a department, and that was what I was tasked to do here as well, where to take it to the next step, of what did we want to be when we grew up? I think we're still asking ourselves that question. I hope we continue to, and I hope we continue to grow. But through that process, we came up with our mission to provide access to comprehensive social services for youth and families, and to enhance behavioral health for the entire Hopkinton community. So our motto under the rug is, if you were born into a family, you belong to us. And so it's kind of hard, the way things work, not to be sort of born into a family. So if somebody comes to us and maybe they're a single adult and they need a resource or whatever, we're not going to say to them, you're not a youth, then you're not in a family unit right now. We're not going to help you. Of course we are. And we'll get them to where they need to go. Sometimes that is more about referrals, but I just want to clarify that we're here for everyone. Hopkinton will be a town in which all people are valued, where behavioral health is a high priority, and residents have a place to turn when they need help. And that was our vision statement that we created at that time as well. Which nicely fits into the town's vision statement, to have high quality services for folks in the community. So our values are that we would be, or that we are, leaders in behavioral health, champions of behavioral health prevention and education. We want to work ourselves out of a job. Like, who wants to just be putting the fires out? We'd much rather prevent those from occurring, right? Advocates for underserved residents, and that we'd be adaptable and collaborative. We believe it's okay not to be okay, and to be able to talk about that. Access to mental health care and substance abuse treatment and recovery should be easy to navigate, stigma-free and open to everyone. If one of us is not okay, none of us are okay. And that's like a fundamental value that we have. That, when we lift up the most vulnerable person, we lift everybody in a community up. And it benefits the whole community. And if that's our standard of care, then everybody thrives. Vulnerability can reflect many different barriers in a resident's life and are not always visible on the surface. So somebody asked us, do you only serve people furthest from opportunity? I think we couch it that way because you can think of it a lot of different ways. Somebody might live in the mansion on the hill, but mental health doesn't pick and choose. Mental health is health, and we can have good mental health, we can have fair mental health, or we can have lousy mental health. And that is not contingent upon zip codes. It's not contingent upon how much money somebody makes. Like, anybody can be touched by struggles with their mental health, behavioral health, substance use disorder, or a turn of events that takes everything away from them. The whole environment around people affects their mental health and wellness. And so we want to be champions of a community that unsilos the work that we're all doing so that we're all working together to build a healthy and strong environment. Okay, something happened. There we go. Where we were in 2020, we wanted to help strengthen and clarify the network of services that acts as a safety net for vulnerable residents, provide primary prevention services to build a healthy community culture, increase community awareness of behavioral health issues, of our mission and our services and how to access help, and develop effective and efficient funding, staffing, and processes. Easy peasy, 1, 2, 3, easy. Not at all, but because we were in a global pandemic, we stayed busy. I could not be a doom scroller like that, like I run on an anxious meter. So to sit there doom scrolling would have sucked out my soul. So instead I grant wrote with Colleen, who was the only staff person with me at that time. And we did a lot of grant writing. We did a lot of exploring and investigating what funds were out there to build an effective department. And so from there, oops, I think I missed the slide and I think I had it back. I'll turn to color. This is why I can't do everything. Yeah. Oh, you just hit those arrows? See? That's the easy things. All right. So where we are today. A resource center was built by our resource counselor, making resources accessible and easy to find. New marketing through social media like Facebook, Instagram, and a created newsletter started to let people know more about us, who we are, what we do, why we do what we do. 2 prevention grants added 2 full-time staff to the department to work locally and regionally in the prevention of youth substance use. Erin is with us through that grant. And we secured the Mental Health Awareness Training Grant through September 2026 to increase community awareness of behavioral health issues, of HYFS's mission and services, and how to access help. And we stabilized the budget to reflect actual spending. We were the beneficiary of a lot of truly wonderful earmarks from Senator Spilka, but we know that that funding is fickle. We know when administrations change, that funding disappears. And so it was really important to me to say, hey, I need you to fund what's real. If we get that other money, we can offset and we can turn money back to the general fund. But as of today, I'm glad I made those choices because those funding streams have dried up and we are funded solidly for what we need. Not everything that we want, but for what we need right now to move forward through our programs and in the maintenance of staff. So, and we were able to expand our services through those grants as well. Where we're going. Well, our strategic plan was a 3-year plan, and we've been about 1.5 years out of that now. We took a little extra time to take a look at the things we didn't complete and try to figure out, is it still true for the community? What do we want to do with that? And we decided we probably need like a new community assessment. So we are embarking on that assessment process now. So you may get a phone call, you may see a survey. We have key informant interviews that we'll be doing. There'll be surveys going back out to the public again. And your support with getting those into the right hands always helps us. We'll apply for the Drug-Free Communities grant for years 6 through 10. We presently have years 1 through 5. We're in year 4. And you'll hear much more about that grant soon. And we'll engage in a new strategic planning process to improve accessibility and inclusion, reevaluate staff roles and find efficiencies, because as you know, like the town budget, it's at risk, and things are tightening up. And we've had a position open for a year that we can't even hire for because we're not competitive enough. And so we have to look what are we going to do about that? What do we do to change up that position to make it more attractive? Do we do less with less? Do we find a way to do more and do it differently? Do we contract in some way with an organization to buff up the services that are missing because we're down a staff person? We have real questions based on the circumstances on the ground. And so to reevaluate what we do and to see, where our strengths are and how we can provide those supports is important. And to utilize community support where we can. A possible Friends of Hopkinton Youth and Family Services and other partnerships to sustain what we have going and to not burden the taxpayers with, what our department does. And so I'm going to segue to Colleen Souza. Colleen is a social worker and a case manager for our department. She sees young people clinically and works with a ton of families. She's compassionate. She's courageous. We work really hard for her to say no. So don't be offended if she ever says no to you. And she's been a tremendous resource to our whole staff, a mentor, and just a really kind and wise listening ear. And so she works with a lot of the families and young people that are furthest from opportunity in the community. She's been with Youth and Family Services before I came. So she's been since 2017 in April. And so she's going to share a little bit with you about your impact and what we need moving forward from people in the community.
So I haven't had to say no because you guys have said yes, which has been a blessing, truly. First, I just really want to say thank you. Thank you for the opportunity to be here. And thank you so much for your collaboration. It just, not just a difference, it's been an enormous difference. I feel very fortunate to live in Hopkinton and work here as well. I am so grateful that back in 2017, that Phyllis and Jackie ran into the former director and sort of started off a relationship at that time. And since then, we've been able to grow with all of you, with more members. And I also just want to say thank you for all of my crazy requests that I have brought before you, and you've had lots of patience. So I'm going to try and talk just for very briefly. So it's made such a difference in countless, I can't even count the amount of families now that you guys have touched from how you have supported us. And whether it's the driver's ed, the holiday gifts, or the gift cards for emergencies. I think sometimes it's hard to understand why a family would need something like driver's ed. And some of the families, many of them now, I think, as you may have heard, there's a lot of single parents now that we're running into, a lot of divorces post-COVID. We've had, a lot of people moving into the town. The population is growing. There is a lot more who have a lot more needs that are moving in. And for a student to be able to sign up and get driver's ed and be taught the right way and go on to get their license provides another resource for that family, because then they're able to go out and get a job. It's hard to commute anywhere from Hopkinton, so they can share the car, the family car that they have. They're able to get a job. They're able to pick up their younger siblings, perhaps go to the grocery store, help the families in more ways than you can think. So I just want to say thank you. I know that's really hard, and I have been working since 2017 to find resources, so I'm so grateful that you guys are supportive of that. And the holiday gifts, it makes me think that when I started in 2017, we had a family with a couple kids, and this particular family was just on Social Security. There was not really a penny more. I was going to Project Just Because, getting food. A lot of things had happened for this particular family. They had run out of money, and they weren't on some other benefits. And that's when I first had met Jackie and Phyllis, and sort of helped to fill Christmas needs for this particular family. And it sort of began this relationship. And now, you guys, this particular year, we've met 3 families. You've met a lot more than that, but helping with holiday gifts, with other driver's ed. These are families that have great needs, and they wouldn't have been able to put these gifts under the tree. I am working hard at sort of, I have a couple thank yous I gave to Phyllis, and sometimes I'm not as good at following up with that, but they are very, very grateful. And the gift cards, it has gone above and beyond. So I have had families that have come in from anything from Project Just Because is closed. It's Friday. They don't have any money. They needed food. They needed toilet paper. They needed something else that they weren't able to access. I've had families that have used them towards a phone, their phone bill, different things for their children, for school. This past year, I gave out like 10 of those amazing backpacks to Hopkinton residents. That has been great in it, and I love it. You guys have helped us with all different drives. So these gift cards are more than sort of like just a card. Maybe they're able to get gas, which means they can pick up their kid from school. They could go to a medical appointment. They could make their job that they might not have, because it might be the end of the month and they had run out. So I, again, will just say it, just thank you for all of your support, for being so generous, so kind. It's not only to work here in this town, but to live here and know that this exists means a lot. So I really appreciate it. Something that we are looking forward to, if anybody's interested, one of the programs, we have a couple things that we do, but one training is called QPR, and it's Question, Persuade, Refer. And it's a suicide prevention training. And we have a grant right now that Dawn had spoke briefly about, and we're trying to train as many people in the community that are interested in that. We want people to sort of be gatekeepers all over the community. We want you to be able to, if you know somebody, all ages, right? Suicide can affect all ages, young kids up to seniors. So if you want to be trained in that, that is something that Dawn and I could come and do at a meeting. It's an hour and a half, and we could offer this training if that is something that you might be interested in. We also run training, so you could come. So if anybody's ever interested in that, and if there's another training that you're interested in, if there's something in the mental health field you want to learn more about, to ask us, because that's something that we could set up. And then we have Hopkinton Organizing for Prevention that Erin is now running one of the grants, and we're trying to lower substance use with youth and prevent misuse, and just making a healthier community in general. We are always looking for community members to join that coalition. So if anybody is passionate about that, if you're interested, we would love to have you for that initiative. I'm going to stop here. I could go on and on, but I'm going to hand it off to Holly, who is created this fantastic resource center that she's going to show you. So thank you.
Hi, I'm Holly Moran. I'm a resource counselor within Youth and Family Services. I started last November, not last year, but the year before. But I was also an intern for Youth and Family when I was getting my MSW. I worked under Denise Hilber, and I got to see Colleen start. So I'm really happy that my career brought me back because it feels like home here. So I'm going to talk to you about the resource page that I made. So when I started, Dawn gave me, I got to talk louder. Dawn gave me a directory that was just words, lots and lots and lots of words. And I was thinking to myself, if I was in crisis, could I navigate these words? And no. So I wanted to make something that was really interactive and really intuitive for people to use. So I'm going to go through like kind of how I started it, and then I'll show you the page and I'll show you how to navigate it. Can you hear me better now? No, you can't hear me. Oh, it's just for the camera. So I'll try to speak louder. I'm not great at it because I'm deaf in one ear, so I feel like I'm either screaming or whispering. And I don't want to do either to you. Okay. So our resource center was created at the beginning of this year. It replaced that like 40-page document of words. I went out into the community and I asked all different groups, like, how do you want to, if you needed help, how would you access it? What would make it easier for you to navigate something like this? And I asked my colleagues and I asked everybody I could think of. The platform is built on a Google site. And so when you see it, maybe I'll pull it up. It's easier to. This is, nope. So this is the resource center. And I'll show you how it's used in a minute, but this is built on a Google site. You can find it on the Hopkinton Town website on our page. And I also have little cards that I'm going to give you that will take you directly to it. Basically, the idea was what would be the easiest way for somebody in crisis or a family that's having whatever difficulty and they don't feel like they can come directly to us to talk because of whatever reason. How can we empower people to find resources and get help? And so to kind of see at the top of this page, we have the information for advocates, which is they have a mental health crisis mobile team that can help in the event of a mental health emergency. But at the very top, we have different little tabs. And I need a slide for this, but I think it's easier if you see it in real time. You see this one, which is a referral to us for help. So you don't have to call the office. You don't have to know our email. You can go to the website and if you fill this out and submit it, it goes to the entire clinical team, which is me, Colleen, Dawn. So you can get your help that way. The other one is the tab next to it brings you to the town site if you wanted to go, I don't know, pay your taxes or whatever. And then I have this site can be translated into any language that Google offers. So if you're helping somebody, if you know somebody that only speaks whatever language, you can translate the site to that language and you can use it. And below it right now, I've highlighted support for winter energy bills. If you go there, it's a whole bunch of resources on how to lower your energy bills or how to get help with that. And then we have just a whole bunch of topics, different types of topics that you might be interested in looking at. For example, I'll bring us to crisis and mental health support resources, this little brain here. And it brings you to a Google form or Google Doc that has direct contact information, information about what the resource is, how to contact them, what they offer. And these, because they're built on Google Docs, they're evergreen. Like this site will never be down because Google Docs can be edited real time. So if I get better information or if I get information from the community that this resource isn't really working well, I'll pull it off. So all of these are regularly vetted to make sure that they're still functional. And that's it. Yeah, and I made so there's all these different categories, and if you go to the bottom, this like white button, it gives you a printable PDF. So if you want to print it all out and keep it on your desk, you could do that. It's going to be a lot of pages, but you could do that. And then right below that, if you are not regularly receiving our newsletters, there's a link to go to all of our newsletters. Or if one day you're like bored and you just want to see all the different things we talk about over the year, you can do that. And in our newsletter, we always have a resource of the month. So I try to always duplicate it to the website as well, so that it's consistent everywhere. Like this month, substance use disorder treatment is highlighted in January. So there's some information about how to get help there. We also have a feedback form. So if you ever go on it and you're like, I really wanted information on this, but you didn't have it, tell me and I'll add it. Because that's how a lot of this stuff gets added, was through the community saying, you really don't have anything on whatever. And this is a resource for the community. So I want it to be made by the community. It's also I built the whole thing on Google Analytics. So underneath the site, it collects data, but anonymous data is HIPAA compliant about what kinds of things people are accessing, how long they're on the site, return visitors, all stuff like that, so that we know how to direct our work better. Like a lot of people are needing housing at the moment. There's a housing crisis, and we have not been immune to that. So we have a lot of folks that need help with rent or finding housing that's safe and affordable or whatever. So every time I get a new housing resource, I add it because this is something that we're dealing with a lot. I have some, let me go back to I just haven't said. So you don't need this slide because I just talked about it. And then this is some stats from last year. So we launched in February of 2024. We have 18 categories of resources, 228 resources on the site. We had 950 first-time visitors last year, and we had 767 repeat site visitors. And of those visitors, we have almost 4,000 clicks for information. And I'm hoping that that number grows this year and that we can make it more available within the community and more accessible. Also, the site is also has alt text. So if you're using a screen reader, everything gets read to you through the site. So you're able to navigate it even if you're low vision or blind. And I also am very, very interested in making it as accessible as possible. So if there's a way that you can see, that we can make it better and easier to read, easier to navigate, please let me know. Because that's the whole point. What's the point of a website if you can't use it? And I brought you all gifts that maybe you don't want. I don't know. But I brought you all gifts. These are QR codes to see. It's this like QR code. If you scan it with your phone, it will bring you directly to the website. I don't know if anybody has any questions about it.
Hi, everyone. Thanks for having me. I'm here to talk a little bit about HOP. So what is HOP? HOP is Hopkinton Organizing for Prevention. It is our local coalition focused on reducing youth substance use in the community. So HOP is a coalition. So what is a coalition? It brings together all the different sectors within the community to reduce substance use. So you can see in this slide, we're comprised of many different sectors within the community. There are 12 listed here. So we have representatives from the business community, we have young people at the table, we have parents, we have religious leaders in the community, we have media, HCAM is part of the coalition, police, fire, civic groups, we have representatives from the healthcare community, the schools are at the table, public health department, as well as the YMCA. And so what do we do? The coalition together works to reduce substance use. So by combining our resources, coordinating our efforts, we can have a greater impact within the community. So to really understand what we do, I think it's helpful to kind of look at our past and how HOP has evolved over the years. So HOP began in 2015. So back then, that was when the opioid epidemic was really a big deal in the community. So it was kind of a loose coalition that formed to really provide resources for opioids in terms of treatment and recovery resources. And we've grown from there. Around that time was when cannabis was legalized, and Hopkinton was deciding whether or not to allow for the sale of cannabis within Hopkinton. So HOP worked really hard to educate the community about the risks with allowing the sale of cannabis in the community. And through their education, Hopkinton actually voted down the sale of cannabis. Also during that time, they focused a lot on education around prom and graduation, and really focusing on providing information to parents about social host laws. And what is that? That's really the liability associated with providing substances to youth. And we still provide education around that today. In 2019, the group hosted their first celebration of recovery, which we also still do today, but it's really an event to celebrate recovery and treatment for substance use disorders. We held the last event this past October. And then around that time as well, so Dawn was hired as the director in 2019, and she began really transitioning the group to more of primary prevention. So what does that mean? It's really the idea of delaying first use. So preventing youth from beginning to use substances and preventing it from kind of boiling up and becoming a bigger problem. So the coalition was all trained on primary prevention as well as coalition building during that time. In 2020, of course, we had the pandemic, and the group hosted their first drive-in movie night for young families. So it was an opportunity to bring people together, but also provide education on substance use prevention. In 2021, we were awarded the Drug-Free Communities Grant, which Dawn spoke to a little bit. But what is that? It's a 5-year federal grant that the CDC awarded to our coalition. So it funds our work. We're in year 4 of that 5-year grant. There will be an opportunity to apply for another 5 years of funding. So that's something we're actively thinking about and planning for. And then that brings us to today. So we have a very active youth group as well as a coalition, community coalition, focused on primary prevention, doing a lot of these activities, as well as many more. You can see here just some nice pictures of, what we've been doing. On the left, you see our giant mega brain, which we actually brought out this past week. But it's a giant inflatable brain that students and families can walk through and actually see how substances impact the brain. And it's a great way to kind of get people engaged and then have a larger conversation about substance use prevention. We bring that out every year at the high school, and the kids really enjoy it. You see a picture from our celebration of recovery. One of our coalition members is speaking there about his experiences in recovery. A flyer from our drive-in movie night. You'll also see a picture of two more of our interns. These are high school students. We actually have 3 high school students who are interns for HOP. And they are very involved in what we do. These 2 are seniors, and they actually created a peer vaping curriculum, which they're going to be bringing to the middle school. So they're going to be teaching the 7th graders about the effects of vaping, and also teaching them ways to refuse. So we'd be naive to think that you can just avoid substances, but it's important to teach kids how to say no and what to do in those kinds of situations. And then last, you'll see a picture of Colleen actually with some students in Washington, D.C. So for many years, we've been able to bring some of our youth to Washington, D.C. to connect with other young people across the country and learn from their experiences, as well as develop leadership skills that they can then bring back to Hopkinton. Here you can see our impact. So it's important to say that with our Drug-Free Communities grant and what we do, it's data driven. So we're always measuring the impact that we have in terms of youth substance use. One of the data pieces that we use is the Metro West Adolescent Health Survey, which is a survey given to middle school and high school students every 2 years. It's about substance use, but also mental health and other things impacting youth lives. But here you can see that since 2014, which is the dark green, and then 2023, which is the last time that the survey was given, in terms of the various substances, use has decreased over time. We can't take credit for the total decline. Over those 10 years, the population has changed, as well as larger public health policies have been implemented, particularly around electronic vapor products in terms of restricting access for youth. But we are measuring and looking at where we can implement various activities in the community to lower substance use. And I guess I'll go to the last slide here. So our future. So what I already spoke to a bit about our peer-to-peer vaping curriculum. We're very excited about that piece. Those students also created a vaping resource center that Holly put on our resource center as well. So we're always, we're kind of connecting our work to the resource center to make it accessible to everyone. We're also looking to make all of our HOP resources accessible to everyone. We are applying for future funding, as I already spoke to about. So in this next year, we'll be writing our grant submission for years 6 through 10 for the Drug-Free Communities grant. We'll be working with an outside consulting group to help us put that application together. And then lastly, we're also collaborating with other local communities. So as Dawn had mentioned, there's another grant that funds our prevention work as well. It's the Mass Call 3D grant. That's a Massachusetts grant that funds a cluster of communities. So we're actually working with several other communities, some of our neighbors. So Medway, Medfield, Holliston, Wayland, and Hopkinton being the lead community in that group. But the idea is to really kind of coordinate our efforts to have a larger impact at the policy level. Lauren Mayer, who's not here, is leading that grant and that work, but the coalition is involved in that work as well. So I will stop there. Happy to answer any questions you have about HOP, or the team's happy to answer any questions about the work we do in youth and family services.
So in conclusion, I realized there's a slide missing while I was sitting here, and it was like this kind of the important slide of what are the bulleted things that we do. And so we do a lot of information and referral. So if somebody has a question and they don't want to go to the resource site, or they can't find what they're looking for, call us up, or fill out that contact form, and we'll get back to you, and we'll kind of guide you through. A lot of what I do is a lot of parent support. Let's take a look at what you've tried, and let's take a look at what you've been doing and what's worked and hasn't worked. And then how do we sort of break that down with the resources that are out there? What might help fill the gaps in the puzzle of what you're trying to do to support yourself or your family or your loved ones. And then we offer limited counseling on a short-term basis. We really try to connect people with other providers through their health benefits. But if they can't, for whatever reason, and there's a lot of different reasons, I won't go into all of those. And then we do a lot of connecting to resources of all different kinds. Sometimes it's as simple as somebody calls up and said, my neighbor moved and there's a washer sitting here that they wanted me to give a good home. And we know somebody who needs a washer. I mean, it's random stuff. And then it's like the important things like mental health support. And not that washing one's clothes isn't important, because when you can't afford a washer, it's a great gift. But all the other things that we, can refer to, whether it be housing resources or financial resources or bullying resources or things that can support families through challenging times. So we belong to coalitions in the community. Through Spark Kindness, there's an identity-based bullying coalition that our department participates in. We participate in housing coalitions. So we're getting some of the most up-to-date information brought back to Hopkinton so that we know the things we're referring to weren't like 10 years ago resource or something like that. But we're here for you. And I think that is the bottom line, or here for your neighbors or the people you might know. When we first started handing out resources about a program called Interface, which helps people find a behavioral health service that they might need, we were handing out cards to everyone at town meeting. And somebody said, I don't need this, and shoved it back on me. And I said, oh, I didn't think you did. But if you kept it in your junk drawer at home, you never know when you might meet somebody who will. Like a neighbor, when you're putting out your trash, might tell you something, and you might think, oh, I've got that thing back in my junk drawer. And so like, think of us as that repository of resources that you might keep, we don't use cards as often anymore. But we're that thing to turn to, when like your neighbor on a walk tells you something and you're thinking, gosh, I wish I knew something to be more helpful. Like I stood there and I listened, but I either didn't know what to say or what to offer. Or I don't know how to support somebody who's lost somebody, or I don't know what to do. We can be here for you. So that's my conclusion, and our mantra. And thank you again so very much for having us today. And for putting up with our little technical glitches and switching microphones and doing all that good stuff. Question?
Any individuals would like to participate in the training programs, particularly PPR, should I send them out via email, or would you like an after meeting?
Sure. We will be offering them again. We don't have dates picked just yet, because we are down staffed by one person. And so that's been challenging for us, no lie. So it impacts how often we can train and what we can provide. But you could either get put on a wait list, like for when our next one, or invite us strategically to one. Like you could say, I'm having 12 people in my living room to learn about this. When can you get here and when could you present this? It can be that small. It can be something that you come to that we host here at the library. there's a number of creative ways to host a QPR training. So we'll go into pre-existing organizations like a women's club meeting, and where we could, you don't have to have the whole hour-and-a-half presentation to get the meat of it. We can make it shorter. I would say the shortest we could probably make it is an hour. But it's the hour and a half is recommended. So there's plenty of time for people to like process and ask questions as it goes along. Then the Mental Health Collaborative offers through the grant training for parents and caregivers. And I look at caregivers also as people who maybe aren't parenting anymore, but maybe have, special nieces and nephews or grandchildren, or maybe like neighborhood kids that they're really fond of, or other adults that, that could use mental health literacy. So it takes QPR and goes a little bit different direction. The concepts of QPR, more about like, what is mental health? What is wellness? How is stress different from anxiety? What language do we use when we talk about mental health? And then how to get somebody help, or how to get help for oneself, and what the different types of mental illnesses are versus when we're just having poor mental health and it's not necessarily a diagnosis. So it kind of breaks apart all that stuff. And that's through the Mental Health Collaborative, which is a nonprofit in the community some of you are aware of. They do those trainings through a grant for us. We pay them to come on in and do those trainings. In the year ahead with our MHAT grant, we want it to be sustainable. So we will get trained in that model and be delivering those independently as well. We do offer one at the Senior Center every year. We don't have that coordinated yet, but that's something that we'll be looking for a date to get in there, to have the Mental Health Collaborative come back and do a training for older adults. And so that's a long answer, but like reach out to us. We can get creative, and we can be pretty adaptable and flexible as to when we hold those trainings. We'll hold them for as few as 2 people if that's what's needed. And I would say about up to a room of 30.
And yes, just you could go on the website that we were saying, or contact, or even call and leave a message on the email for Dawn, Holly, or myself. Absolutely.
They all have the contact page.
Yes, you have that. There's an email contact.
And if you'd like to be a member of HOP, HOP isn't just about substance use prevention, but there is like a little wing of it that's about mental health promotion. And it's a fledgling little wing right now. Like we need more people. We need more grassroots folks to come step in and help out with the mental health promotion piece, to get those meetings like on a regular basis and to get some more good work done.